shared vision, our grand vision in ARC Northwest Coast amongst all of our organizations is to reduce, if not to eliminate, health inequalities in the region. And you might have spotted before that there is a calling out bubble for champions on the very top. But to be honest with you, at the time we created this infographic, I don't think that necessarily referred to a formal network of champions. I think it was more about people who were just intuitively maybe, or just because they're passionate about it, to spearhead the implementation of an equity lens. So there's a saying that purpose guides you, vision is what you aspire to, and impact is what matters. So impact would be the measurable results of achieving that vision. So if we aspire to reduce health inequalities because our mission is to improve population health and well-being, it is then equity research that can guide us in that process. Are you with me so far? Lunch not too heavy, good. So remember your theory of change, and that's what we use when we try to plan the pathway to a change we want to see. So it helps us map out how and why a change will happen within a particular context. So in our case, we want to change the levels of health inequalities, and we have agreed that to get there, we need to embed equity research in our work. You did just agree to it. So taking a step further back, how do we succeed in embedding that equity research in our work? And that's where the evidence-based implementation strategy of champions stems from for us. Imagine yourselves your champions. You can be of health equity research or any other cause that's close to your heart, okay? Doesn't matter. Then turn to the person left to you. Imagine they're an aspiring champion of that very purpose, but not quite there yet. So have a discussion with them and try and convince them and tell them why they should be taking on this role of champions like yourselves.
We were convinced, but we were also able to guide as we were being told, and it was just that movement of just take the academic hat off for a bit and go into a different layman's term. And when that hat was taken off, it suddenly changed. I was convinced because I wasn't hearing the specific academic terminology, and it was relating to me and what I wanted to hear, which was about impact and the difference and the change that I would be able to make.
We kind of swapped roles because it turned out the person I was trying to convince is actually, I think he's already an equity champion. And I think, the way he convinced me was that it's real life examples of people where there really are differences and how they can change. So it's like being given real life examples, I think, of what is real, what is a real inequity, and what can be done.
Help facilitate change across our groups. It could assist in identifying and mitigating any resistance to applying that equity lens. It could provide others with an informal environment to share those thoughts and challenges with equity research. Or they could impact on others to help them embrace and learn and adopt any relevant changes that we're trying to make. So it's quite likely, I'd expect, that some of the ARC staff members and member organizations are already working with champions intuitively, like we originally put it on our infographic. But the suggestion here is that we would all benefit from learning from others' experiences and thinking more strategically and systematically about how to engage those champions to the fullest extent possible. And then, of course, more systematically monitor and evaluate partnerships with champions and better document that whole thing, both for internal use and external sharing.
champion work that I've been most involved in was around kind of making every contact count, and that whole programme. And I think doing some work around that really taught us that leadership buy-in in an individual organisation to that as a priority. That's as important as having a champion. And so I suppose it's just noting that obviously, as you say, the champion approach is evidence-based, and so it should work. But there's also a thing for, I think, so I'm from Blackpool Council, and there is definitely a slight sense sometimes of another thing that we need to be doing or championing. So we've got several champions in the council for different things. So I think it's just really key to kind of go at it from the champion side, but also really get organisational senior leadership buy-in to support that champion work.
So it's not so much a disagreement but a concern with champions. Would it then just become their responsibility, and can it sometimes champions can just be single individuals rather than like a group movement? And then some people could see it, oh, they're the champion, it's their role, and we need to keep this as a collective movement, would be my concern.
We also discussed the issue of having the champions. Really, we talk about, are they going to be recruited? Are they going to be volunteers? Will there be a criteria? And then what about the funding for it? Because you don't want them to be out of pocket if they're going to serve, but they'd be good for the community, for the public as well. So I'm not disagreeing, but that's all the area we need to think about before we ask people to become champions. Thank you.
So online, definitely in local authorities, the research champion role should be central to building links between research and practice. LAs are often severely limited in what they can do and achieve in terms of research to a standard that we would expect of ourselves. So that's one comment. There's another comment. Absolutely agree. It is the next step on the equity ladder for public involvement to grow.